Minister for Children and Families.
Given the 2023 findings of the Care Commission, which found that 3 children's homes were not fit for purpose, will the Minister explain how he proposes to increase the number of care providers in Jersey so that children do not have to leave the island?
Minister.
Thank you for that question, and thank you, sir. Emergency accommodation was established for children requiring urgent care and protection. And at the time, there was no places available across our care services. I would like to point out that actually this accommodation was required as a number of children had been put in our care by the courts, and it was in fact the week before Christmas. Emergency accommodation is referred to as regulated activity in unregistered settings. It is not a care home, as was reported in the media. This type of emergency accommodation is extensively used across the UK and had previously been used in Jersey in a number of emergency situations. I am pleased that in fact it was accommodation of an extremely high standard and had been used in the past. Nevertheless, as it is in unregistered settings, it will never be able to meet all the regulations associated with regulated activity. The department has since opened 2 new children's homes, and that took some time. This will prevent the need for emergency accommodation in the future. There have been no further incidents of unregulated activity or children accommodated in unregistered settings, and we have no unregistered provision at present. Moving into 2024, our fostering service delivery has received a revised and innovative approach to meeting our sufficiency duty on the island. That is to say that we are beginning to replace care homes where possible with foster carers, which provides a much better environment for children. Many fostering service providers across the British Isles and beyond were impacted significantly by the COVID-19 pandemic, with a focus on fostering recruitment significantly reduced amongst the general public. And this again was one of the reasons why at that time we had no accommodation available. This year, Jersey Fostering Service has a wider reaching recruitment, marketing and comms strategy, and adjustments have been made to work streams within the service delivery to ensure faster response rates, robust timescales, and a high level of preparatory and mandatory training available for foster carers, and a fully staffed service. As part of our new strategy, since January, we have 5 new general fostering households approved, and 1 intensive foster carer household approved, and 2 other connected fostering household approvals. We have 4 more households coming through the fostering panel in the next 3 fostering panels. 1 family were allocated for full assessment this week, following the Skills to Foster preparation training. There are 4 more households submitting fostering applications as a result of this training in the next 2 weeks. They will be allocated for assessment within 7 days. We will have exceeded our annual target by June. We are now busy preparing for all our new Teens campaign, which are likely to generate more inquiries. We have a robust timetable of regular recruitment campaigns throughout the year, alongside new plans for constant presence across the island. We have an extremely energised and passionate fostering team delivering our services this year. All of the children's homes have been visited by the Interim Director of Children's Social Care. I joined some of the visits. Independent visits are conducted every month to quality assure the homes under Regulation 31 of the Regulation of Care Law. A new service improvement lead has been employed to manage the homes and work on improvements so that each unique child is receiving the best care. Where possible, our children in Jersey are placed on island. There are 15 children placed in the UK, and the recent inspection by the Jersey Care Commission noted that the level of care is very good. A social worker is placed in the UK to visit our children, and her presence was also noted to be excellent. I should point out that placements in the UK tend to be where specialist care is required, which isn't available on an island which is 9 by 5. Thank you.
Yes, supplemental question. Ms. Springett. You now have the chance to ask a follow-up question on the basis of what the Minister has said. You can ask it, the Minister has covered a huge amount of ground, more than one might normally get in an answer to an oral question. But if you have a supplemental question, you can, and then there'll be a period of about 8 minutes or so for anyone else to ask their own supplemental questions and for the Minister to be given a truly difficult time. Yes, Ms. Smith.
Given the heightened demand for social workers due to the rise in number of children in care, what strategies are being employed to alleviate their heavy caseholds and ensure staff retention within the system?
Thank you very much for that question. In fact, caseloads in Jersey are not as high as you would have in the UK. And in fact, when I visited the Isle of Man, our caseloads per caseworker are in fact lower than theirs. So in fact, the caseloads aren't the problem. The problem is a shortage of social workers, and that's a UK, Europe-wide position at the moment, and something that appears to have happened since COVID. What we are doing is we have a large number of people who are actually on contract, but when I say a large number of people, a year ago we probably had 60% of the people on contract, and we've actually reduced that to 40%. So we now have 60% full-time employees and 40% on contract. So we are managing the situation, and we are also managing the caseloads. Thank you.
Any other supplementary questions? Ms. Vera.
How does the government plan to address the shortage of intensive foster carers, particularly in the light of urgent need for specialised support for children placed in such care arrangements?
We are, as part of our campaign for foster carers, we are actually attempting to take on more intensive foster carers. Of course, that requires a greater level of training and a greater commitment. We are developing new packages for those people, and I can say that we have actually already been successful in that we had one new intensive foster care household approved in this quarter. So it's something that we are working on. We're providing the training and also the package that goes with that. Thank you.
Did you have a follow-up question to that, Ms. Vera?